Antimicrobial stewardship, a competency-based approach. Introduction. Antibiotics are life-saving drugs, and their discovery is among the most important advances of the 20th century. There is, however, accumulating data illustrating that antimicrobial misuse is widespread in all healthcare settings. This misuse contributes to the emergence of multi-drug-resistant organisms, which threaten to undermine many of the most important medical advances of the last century. Antimicrobial resistance is a global public health problem, requiring a global solution. Antimicrobial resistance does not respect borders and can therefore spread among countries. Left unchecked, antimicrobial resistance will result in significant human and economic cost, with estimates projecting 10 million deaths due to multi-drug-resistant organisms per year in 2050, costing over $10 trillion. In response to this growing global threat, the World Health Assembly adopted a global action plan to address antimicrobial resistance in 2015. This plan outlines 5 objectives, including to improve awareness and understanding of antimicrobial resistance through effective communication, education, and training, and to optimize the use of antimicrobials in human health. This course is designed to address these 2 broad objectives by training frontline clinicians in the optimal use of antimicrobials. Frontline clinicians play a vital role in protecting the power of antimicrobials. Antimicrobials are not like other drugs. They are unique in that both the individual patient and the broader society bear the consequences of their use with each prescription. Antimicrobial use is a main driver for the emergence of drug-resistant organisms. The antimicrobial effect that saves lives also exerts a selective pressure on replicating bacteria that leads to the emergence of drug resistance. Remaining mindful of the societal implications of antimicrobial use during individual patient and clinician encounters is challenging. Many factors influence clinicians' antimicrobial decision-making and can prevent good practice, ranging from diagnostic uncertainty and knowledge deficits to patient and time pressures. In addition, many clinicians were not trained to prioritize using antimicrobials wisely. The word stewardship is defined as the careful and responsible management of something entrusted to one's care, as in the stewardship of natural resources. To address antimicrobial resistance, all clinicians must become stewards of antimicrobials by prescribing them appropriately and educating their patients and colleagues on the proper use of this increasingly scarce medical resource. Antimicrobial stewardship in clinical practice is based upon the following principles: making the correct diagnosis and only prescribing antimicrobials when indicated. When antimicrobials are indicated, clinicians must prescribe the most appropriate drug at the right dose, via the right route of delivery, and for the most appropriate duration. A convenient mnemonic to help clinicians remember the components of good stewardship is advocated by the Antibiotic Expert Group and is shown here. In many cases, becoming an antimicrobial steward simply requires an adjustment in the clinician's approach to a patient. We have designed this course for clinicians who commonly prescribe antimicrobials. The course is meant to equip clinicians with tools to improve their use of antimicrobials in daily clinical practice by highlighting through case-based examples how antimicrobial stewardship principles can be applied to common clinical scenarios. While we hope that these cases help reinforce existing clinician knowledge, this course is not meant to supplant clinical judgment and the need to seek the advice of specialists, particularly for discussion of complex cases or for those patients whose clinical considerations are beyond the scope of most guidelines. In this course, we will first review foundational clinical knowledge necessary to use antimicrobials wisely. Then, we will illustrate how clinicians can incorporate this knowledge into their daily work using common clinical scenarios. Reflecting the fact that antimicrobial resistance is a global threat requiring a global response, we've drawn supporting literature from many published national and societal guidelines. This course is designed to complement these guidelines with particular reliance on well-vetted and publicly available information. Users may find certain guideline recommendations more compatible with their specific clinical practice environments. The clinician-patient encounter, which is outlined in this figure, provides the ideal framework for this course and will be familiar to practicing clinicians. Although the timing may differ in the outpatient and inpatient setting, the general flow of decision-making is similar. First, clinicians must make a clinical assessment by performing a history and physical examination. Then, they determine if further diagnostics are necessary and decide what therapies to offer the patient, including antimicrobials if indicated and drugs that can provide symptomatic relief. Intrinsic to this decision-making process is the consideration of the local epidemiology, such as national surveillance data and local antimicrobial susceptibility data relevant to a patient's presentation. Throughout the encounter, clinicians provide patient education regarding their illness. If diagnostics, such as a urine culture, are ordered during the initial encounter, clinicians will follow up on the results. The turnaround time for results, including microbiologic results, will vary depending on the available resources. Organism identification and susceptibilities to antimicrobials from culture often take several days. In some circumstances, clinicians may also reevaluate their patient and may, if necessary, modify their original decision-making regarding antimicrobials as directed by the microbiologic data and their patient's clinical course. This reassessment is a necessity in the management of hospitalized patients. This may also necessitate expert consultation with a clinical microbiologist, pharmacist, or infectious diseases specialist as indicated by the clinical situation and the patient's trajectory. The principles of antimicrobial stewardship impact all stages of this clinician-patient encounter. Throughout this course, we will use this framework in common clinical scenarios to illustrate how clinicians can incorporate antimicrobial stewardship in their daily work. In preparation of this course, we reviewed several existing competency frameworks for healthcare workers in order to identify a set of core competencies required for optimal antimicrobial prescribing. The 5 core competencies shown here were selected by a multidisciplinary team based upon review of publicly available descriptions of core competencies, including those for medicine prescribing in general, antimicrobial prescribing in particular, integrated care, and general therapeutic practice. Throughout this course, we will demonstrate how the core competencies are the foundation of the clinician-patient encounter and how this approach can be used to practice good clinical care while also combating antimicrobial resistance. Incorporating antimicrobial stewardship principles into daily practice may simply require reframing your approach. In order to adhere to these principles and the core competencies, clinicians should ask themselves a series of questions during every patient encounter to guide their decision-making about antimicrobials. Are antimicrobials indicated in this patient's case? What is the likelihood that this patient's symptoms are due to a bacterial infection that will improve with antibiotics? What diagnostics, if any, do I need to help me make this decision? If antimicrobials are indicated, what drug is the best choice for this patient? If no diagnostics are available, are there local or regional guidelines that outline appropriate empiric options? If yes, do these guidelines take into account local susceptibility data? What drug will be the most effective for treating my patient's infection while minimizing the chances of adverse events, including allergic reactions, side effects, Clostridium difficile colitis, and organ toxicity? If the patient is already taking antimicrobials, is she taking the most appropriate drug at the right dose via the right route of administration and for the most appropriate duration? Would a consultation with a clinical microbiologist, pharmacist, or infectious diseases specialist assist me in the care of my patient? And finally, how can I limit the societal impact of this antimicrobial use? Examples of this include using evidence-based guidelines in antimicrobial decision-making, limiting the duration of antimicrobials given, using the narrowest spectrum agent appropriate to the diagnosis, or considering an alternative diagnosis if a patient is not improving on an empiric regimen. In addition, clinicians serve as patient educators to raise public awareness of the enormous problem antimicrobial resistance and should inform patients of their role in promoting appropriate antimicrobial use. Emerging antimicrobial resistance affects every patient and every family. Patients play a critical role in preserving the effectiveness of antimicrobials for future generations. Antimicrobial resistance is a daunting economic, public health, and security threat for the global community. We clinicians must embrace our roles as frontline stewards of antibiotics to preserve this precious, non-renewable resource and to protect our current and future patients. This course will provide a framework for approaching each clinical encounter from the perspective of combating antimicrobial resistance. We hope it will assist you in your practice and inspire you to be a champion of antimicrobial stewardship.